Hi, I'm Dr. Kindschi. I teach anatomy and physiology here at Milwaukee Area Technical College. What is A&P? Well, it's fascinating and timely. You know, you're going to learn a lot about science and biology and how the human body works, and there's always things to talk about in the news. Gene therapy and new treatments for cancer, new diagnostic tools. A&P is personal and reflective because everything that you learn about A&P is about your body, and it gives you an opportunity to think about how you're put together and healthy lifestyles and diet. A&P is inspiring and aspirational. You know, we're all moving forward in life to become nurses and doctors, and I'm sure you're going to find all kinds of interesting things in this class that really will inspire you to think about your future and about your future family. Of course, everybody knows this one, A&P is challenging. It's a very difficult course, but it's super rewarding. You're going to learn so much, and hard things are often well worth doing. You're going to need a lot of skills to be successful in A&P. English skills, reading and writing are still the fundamental skills of any successful college student. And as a future nurse or doctor, you're going to be reading medical charts and writing and dictating and communicating with your peers to make sure that your patients are getting the very best care. Medical terminology is really a fundamental skill for A&P. If it's not a required course for your program, I would really encourage you to dig into MedTerm and get some flashcards and a workbook. It'll really help make anatomy and physiology a little bit easier. There's definitely a fair bit of chemistry and biology, of course, for us to understand water-soluble and fat-soluble things, different chemical classes, genetics, how the cells put together, and basic fundamental biological properties like receptors and chemical messengers. Once you get into A&P and learn the things that you're going to need to, look where it'll help you go. Anatomy and physiology is the fundamental skill and knowledge set behind pharmacology. A&P really is the normal structure and function that'll help you better understand pathophysiology when things aren't working right. And for nurses and doctors, your diagnostic skills, patient care, and the development of treatment plans are all fundamentally based on your understanding of normal structure and function. Hey, guess what the single best predictor of success in healthcare careers is? IQ? No. Net worth? Or your GPA? Nope. It's your grade in anatomy and physiology. And so the hard work you do this semester will really help pave your path to success as you work your way into the program. Here's some advice from former students. Time management is probably the key skill for success in college in general, but especially with anatomy and physiology. The general recommendations are for each 1 hour we spend in class, you should plan on spending 2 to 3 hours outside of class. So that's often 10 to 15 hours a week just for this one class, but it really is the key. Self-discipline, saying no to parties and social events when you have an exam coming up, setting goals so that you remember why you're working so hard, and building regular scheduled studies into your weekly calendar are all successful strategies. Students tell me that they need to get social for interactive learning and support. This is well backed up by research too, to show that when we're in a social environment, we're much more engaged and we can help each other out in positive ways and support each other on those days when we're really struggling. Get to know your teacher and your neighbors so that you're not just walking into a quiet classroom where you feel like a stranger. Open lab is a must. What I mean is many of our colleges have opportunities where students can go and get hands-on experience with the anatomical models. And they are really important places like STEM centers in some of our campuses, or tutoring centers, or academic support. Don't be afraid to ask for help. None of us can do it alone.